Calcium entry blockers, or calcium channel blockers, CCBs for short, are vasodilators, or medications that promote dilation of blood vessels. These medications are mainly used to treat hypertension, or high blood pressure, and angina pectoris, which is a pain caused by reduced blood flow to the heart muscle. Now, by definition, blood pressure is the force that blood exerts on the walls of blood vessels, and it's basically what keeps blood flowing and perfusing tissues to deliver oxygen and nutrients. Hypertension happens when this pressure is higher than it should be. In most cases, the cause is unknown. But basically, we can do a number of things to help lower the blood pressure. First, we can decrease the heart rate or the myocardial contractility, so the heart pumps less blood into the blood vessels. In other words, diminish the amount of blood that exerts force upon the same area. Or we can vasodilate the peripheral blood vessels, which increases the area for the same amount of liquid that exerts the force. Angina, on the other hand, is a type of chest pain caused by insufficient oxygen supply to the myocardium to meet its demand. Generally, the underlying cause is the presence of atheromatous plaques in the coronary arteries, which decreases the blood flow to the heart. So, to help diminish the symptoms, it's important to decrease the oxygen demand of the heart, again by decreasing heart rate or myocardial contractility, and increasing the oxygen supply by vasodilating the coronary arteries. Now, let's look at how calcium channels affect heart function. First off, the heart rate depends on the rate that the pacemaker cells in the sinus and atrioventricular node generate action potentials. These action potentials start automatically when sodium channels slowly let in a stream of sodium ions, which causes the membrane potential of the pacemaker cells to become more positive. When this reaches the threshold membrane potential, it's the cue for voltage-gated calcium channels to open, allowing a large influx of calcium ions, which depolarizes it further. Then, these calcium channels close and potassium channels open to let potassium out of the cell, so the membrane potential goes back down, or repolarizes. Now, each cycle of depolarization and repolarization represents a single heartbeat, so how fast this process repeats in 1 minute determines the heart rate. Okay, so now let's look at the cardiac muscle and the vascular smooth muscle contraction, which also depends on calcium. Voltage-gated calcium channels in the membrane of the muscle cell open when they receive an action potential, and this allows calcium ions to flow into the cell from the extracellular space. The extracellular calcium causes the release of intracellular calcium ions stored in the sarcoplasmic reticulum. All these calcium ions then bind to troponin regulatory proteins, which change shape and release the thin filaments into the muscle fiber. This allows thin filament to bind to the thick filament, eventually leading to muscle contraction. In the heart, this means greater myocardial contractility. In blood vessels, this means vasoconstriction. Okay, so calcium channel blockers, as the name suggests, block voltage-gated calcium channels. We can divide calcium channel blockers into dihydropyridines and non-dihydropyridines. Dihydropyridines include medications that end with the suffix -dipine, like nifedipine, nicardipine, amlodipine, and nimodipine. These medications act mainly on the smooth muscles of the blood vessels. Non-dihydropyridines include verapamil and diltiazem, which both have a greater effect on the heart compared to dihydropyridines, but are less effective for vasodilation. So let's start with dihydropyridines, which are mainly used to treat hypertension. They preferentially exert their effects on arterial smooth muscle, and nifedipine is the prototype of this class. Besides treating hypertension, dihydropyridines are also commonly used to treat other disorders. Since they can also dilate coronary arteries, they are effective for preventing angina. They can treat Raynaud phenomenon, a disease caused by vasoconstriction of the arteries in the tips of the fingers, causing them to turn white, then blue, and finally red. Lastly, they're used to prevent cerebral vasospasms after a subarachnoid hemorrhage. For side effects, dihydropyridines cause reflex tachycardia, which means that the vasodilation is sensed by the sympathetic system, which increases heart rate in order to maintain perfusion to the tissues. Fortunately, this reflex is triggered at higher doses than those needed to lower blood pressure. Next, vasodilation is also responsible for the side effects of dihydropyridines, like flushing, dizziness, and peripheral edema. Another side effect is gingival hyperplasia, but the cause is still unclear. Now, let's switch gears and talk about non-dihydropyridine calcium channel blockers, verapamil and diltiazem. These medications are highly selective towards the heart and are classified as Class 4 antiarrhythmics. They're particularly useful for treating arrhythmias that cause increased heart rate or tachyarrhythmias like atrial fibrillation and atrial flutter. Verapamil is more cardioselective than diltiazem, making it the more potent antiarrhythmic. Next, both medications also decrease myocardial contractility and provide moderate dilation of coronary arteries, so they're also used for treating angina. Now, diltiazem is more effective than verapamil as a vasodilator, although not as effective as the dihydropyridines, so it's a better antihypertensive. Since non-dihydropyridines decrease the heart rate and contractility, they are contraindicated in people with bradycardia and heart failure. In fact, they can cause bradycardia as a side effect. Other side effects are constipation and hyperprolactinemia, or a high concentration of prolactin in the blood. Now, let's make a simple and fun mnemonic that'll help you efficiently memorize these farm facts. So, let's start with a river full of milk to represent the calcium entry blockers. On the left side of the river, we have the dihydropyridines, and on the right side of the river, we have the non-dihydropyridines. Since the dihydropyridines are more selective for blood vessels, let's put a flag on this side with a big artery on it. On the non-dihydropyridine side, let's have a flag with a heart on it, since they are more cardioselective. The dihydropyridines all end with dip bean, so let's put a giant bowl of bean dip under the flag. There's a blood pressure cuff wrapped around the bean dip, since their main indication is for treating hypertension. Now, this bean dip contains some extra protein in the form of body parts, which will represent the other indications. There's a bleeding brain in the dip for subarachnoid hemorrhages, a heart with a knife in it to represent angina, and finally, a severed hand with pale white fingertips to represent Raynaud's phenomenon. For side effects, let's have a rabbit with a heart-shaped spot cautiously approaching this bean dip to represent reflex tachycardia. It's blowing a big bubble from the bubble gum it's chewing to represent gum hypertrophy. Let's give it big red cheeks to represent flushing. So now let's go to the other side of the river for the non-dihydropyridines. For verapamil, let's use a rapping vampire. For indications, there's a bunny with a heart-shaped spot who's playing the drums off beat. This represents tachycardia and arrhythmias. By the vampire's feet, there's a heart with a knife through it to represent angina. For diltiazem, let's put an oil drill by the river. Now, it shares the same indications as verapamil, but since it's closer to the left side of the shore, it also causes moderate vasodilation, so it's effective in treating hypertension. So let's wrap a blood pressure cuff around it. For side effects of the non-dihydropyridines, let's put a toilet to represent constipation. There's a frozen heart on the toilet, which represents bradycardia. And finally, let's have a cow licking the frozen heart for hyperprolactinemia. Alright, as a quick recap, calcium entry blockers are divided into dihydropyridines and non-dihydropyridines. The dihydropyridines mainly target the smooth muscles inside blood vessels and cause vasodilation, so they're used to treat hypertension and angina. The non-dihydropyridines are more effective at targeting the heart, decreasing the heart rate and contractility. They're classified as Class 4 antiarrhythmics and are used to treat tachyarrhythmias. However, they can also be used to treat angina since they decrease cardiac demand. Some non-dihydropyridines, like diltiazem, even have a moderate vasodilatory effect, so they can also be used to treat hypertension. But wait, there's more! Here's a mind map with all the mnemonics from the video. Go ahead and pause the video so you can test yourself and see what you remember. Stay tuned for the answers at the end.